Hi, I'm Dr. Raj Sinha. I'm an orthopedic surgeon specializing in hip and knee replacement, practicing here in Palm Desert, California at Star Orthopedics. I've been in practice for 22 years, the last 16 here in the desert. I've had the good fortune of being involved in designing implants for several different companies. One of the common things that people ask me about is what exactly is a knee replacement? They hear the term total knee replacement and they think we're going to cut off large parts of their leg and then put metal and plastic back, like some sort of cyborg technique. That's not really what a total knee replacement is. When we use the term total knee replacement, what we're talking about is all three compartments of the knee. So if you look at a normal knee, for example, this is a normal knee. You've got the thigh bone and the shin bone, and they come together to form the articulation or the joint surface. So these are considered compartments of the knee, these two spaces and then this area here. So when we talk about total knee replacement, what we mean is that we're going to remove the damaged tissue in all three compartments and replace it with metal and plastic. So what that looks like is something like this. So this is an example of a total knee replacement. So what we've done in this operation is on the end of the thigh bone is we've trimmed about 3/8 of an inch of bone only off the end of the thigh bone. And then we've put a metal cap back on the end of it. On the shin bone side, we again trim off about 3/8 of an inch off the top of the shin bone and then put a metal tray that goes inside the bone, like this, goes inside the bone. And then this plastic bearing becomes the new joint surface. And so that's how the joint moves. Your kneecap sits here. We retain the kneecap. We don't take that out. There's a tendon below, a tendon above. The ligaments on the side remain. And then there's two ligaments on the inside of the knee. Some surgeons will take both of them out. Some will take one of them out. But the reality is we're preserving as much normal structure as we can, just resurfacing the bone. And that's a much more accurate term for a total knee replacement.